entertainment.
Ako po, no, sa halos araw-araw na ginawa ng Diyos. Hindi ko nalilito ko rin pag-usap. That's the very reason why I have my PowerPoint. To me, the PowerPoint is very effective. Why? Yung attention ng audience ko, nakakuha ko kasi may visuals. Eh kung wala nga yung makikita, di siguro baka magutulog na lang kayo. Di ba, nakaganyan. Alam mo, nakikinig. Wala. Papasok dito sa lalabas na sila. Samantalang kung may visuals, hindi na mahirap yung produkto na ipapromote. Diba? Everybody is vitamin C. So ang labanan na lang yan, how good is the product. So the quality of the product is number one. And then of course, yung paraan nyo pagpapromote ng product. But before you can effectively promote any product, you yourself should be the model. Para din yan sa dermatologist. Pumunta ka sa dermatologist. Kasi yung itsura ng dermatologist mo, hindi maganda yung skin niya. Eh, maniniwala ko ba? Yan ang comment mo. Eh, siya nga, sarili na natin. Hindi niya
True.
Nagpo-promote ka ng slimming product. Tapos ito.
Ang taba-taba.
So,
Yes.
Yeah, you have to be the model
That's right.
of the product that you promote.
Yes.
That in itself will speak a lot of you. And the product, of course. Ganda talaga yung product. Gumaling ako, hindi ako nagkasakit. Sabi ko nga ngayon, doon sa mga mayayaman na mahilig mag-invest sa properties, mahilig mag-invest sa jewelries, you need to invest in them.
Yes.
Kasi pag tayo, hindi ko naman hinihiwalay sarili, pag tayo na-disgrasya, 6 feet under, hindi naman natin may sasama na yung ating ari-arian.
Yes.
Eh, minsan nakakadinig pa tayo, naiwan ng pamilya, nag-aaway-aaway dahil sa iniwanan lolo na tayo. So, the first thing that you should do, kaya nga ang ganda nitong new lifestyle, no? Meron mo yung product, meron pa kayong property. And the company is encouraging you. Aside from promoting the product, is also to invest. Kasi nangyayari sa, I hope you don't mind me saying this, marami na kumikita ng maayos. Pero after a while, naubos na yung pinita. Kasi hindi mag-save. Walang pinaglalaanan. Samantalang kung meron kayong pinaglalaanan, bahay, condo unit, properties, may pupuntahan yung pinaghihirapan. So it's very, very good. Baka sabihin nila, Dok, ba na yung ngayon na ako. I was not born, kaya nag-aral ako sa Ateneo. I took up my master's in business administration. Pero after that, sabi ko, hindi talaga ako magaling sa business. Kaya when it comes even sa networking, hirap na hirap ako. Hindi ko maintindihan. Siguro kasi sa akin, ang focus ko yung mga produkto. Because the first thing that you need to focus on, not really the products. Dapat secondary na lang yung kita. Because the moment na maganda yung resulta ng produkto, lalo pa kayo natutulog, tayo lahat natutulog, then it follows na natin yung inyong produkto. Okay?
Yes.
So, okay, this is the product, okay? Sodium ascorbate with ZINC, okay? New lifestyle C. Bakit ba no-approve therapeutic drugs? Okay? Hindi na bibigyan emphasis yan. FDA, we have to follow the rules and regulations of the FDA, naturally. Kasi baka malaman, sabi ko, walang FDA, wala walang CTR, walang NTO. Anyway, the point of saying no approved therapeutic range sa supplements is because it should not be substituted to the standard treatments. Meaning, i-incorporate. Kaya nga supplement, tutulong, magko-complement. Kasi marami sa mga pasyente yung panahon na pinitake nyo. Then, there is where the significant side effects come in. Okay? Kaya nga ngayon, ang laking issue yung CKD. Ano yung CKD? Chronic kidney disease. Bakit napakaraming dinadialysis? Simply because nag-fail na yung kanilang kidneys, kidney failure. No? Bakit? Isa sa mga dahilan is of course the prolonged intake of synthetic maintenance medicines. Kaya tinitimbang din natin. Kaya nga inuunti-unti natin. Hindi pwede basta-basta. Okay, so obviously, why do we need to take vitamin C in general? No? Simply because the human body cannot produce its own vitamins. Kaya wala tayong vitamin C na napuproduce. So that's the reason why, even if we take mega doses, which means maramihan, never follow the minimum dose. Why? Walang mangyayari. Sayang ang lalo. So we go higher. No? 4, 6 capsules a day, hindi kayo mind you. Ako sa inyo pagka may nangyari sa mga wala ang mangyayari sa inyo. In fact, the opposite will happen. Lalo kayong gumaganda yung takbo na inyong closure. Remember, yung katawan natin, para din yung makina ng sasakyan. Kahit na anong pagpapaganda mo ng sasakyan mo, maintain mo, because of the normal wear and tear, hindi mo pa rin pwede compare sa bago. Kaya hindi naman katulad yung sasakyan yung katawan ng tao, hindi mo na pwede. Ika na nga natin sa katawan natin ng mas bago. So, the most that we can do is to improve it continuously. And one way of improving yung overall health natin is by taking new lifestyle vitamins. Okay? Yung ating. So, wala tayo eh. Wala tayo. Produce our own vitamins. Kahit na maraming vitamins yung pumasok na natin, okay na. Vitamin C is the most fundamental vitamin of vitamins. Okay, there are different vitamins. Vitamin A, B complex, C, D, E, and K. Yung vitamin B complex and vitamin C are water-soluble vitamins. That's the very reason kung bakit pag umiinom kayo ng new lifestyle vitamin C, you have to drink a lot of water. Maraming tubig na kayo uminom. Hanggang sa malunan kayo. So again, 1-2 glasses of water every time you take it. During the day, sabihin naman kasi ni ba, Doc, ang hirap, maraming tubig, na napupuwet ako sa kahit iisipin. During the day, then you take a lot. Kasi, kung ba naman yun, huwag ka lang sa singat, katatamaran pa nyo. Never hold on to your urine. Sa mga babae, hindi natin masisi kasi minsan wala silang malinis na singat, ayaw nilang gusto dito. Kung tayo mga lalaki, konting dito lang sa tabi, hindi lang. So, no problem. But never try to hold on to your kasi pag-umpisa din yun ang problema. Okay? That's the reason why nagkakaroon ng kidney problems. Bakit nagkakaroon ng kidney failure? Because one of the reasons, of course, kakulangan ng iniinom na tubig.
Yes.
We need to drink on the average 3 liters of water a day. How much is 3 liters? Yung soft drinks nila, 1.5 o dalawa nun. Hindi ko naman lalangmakin din ng isang beses po ito. So, what I usually tell patients is that, okay, as much as possible, you take water, a glass of water almost every hour. Kasi may studies na lumabas na the moment you feel thirsty, that is already the initial sign of mild dehydration.
Ay.
So, ibig sabihin, hindi na tayo dapat
Ala.
dumating yung punto na manguha bago tayo uminom. Dapat lagi tayo uminom. Okay? Because scientific studies show that vitamin C is the most common but unrecognized physiological diseases. Lagi siyang parte ng nagiging problema kung bakit nagkakasakit. Of course, it's not vitamin C deficiency na rason kung bakit nagkakasakit. But it could have contributed to the problem. It's a combination supplement. Why combination supplement? Kasi meron pa rin mga ingredients na kasama doon sa new lifestyle vitamin C. Sodium ascorbate. Bakit ba among the different alkaline vitamin C, sodium ascorbate is the most popular? Kasi when you say sodium ascorbate, merong potassium ascorbate, merong calcium ascorbate, merong magnesium ascorbate. These are called mineral ascorbates. But among these different mineral ascorbates, yung sodium ascorbate has been found to be the best. Mas maganda siya sa potassium, sa magnesium, sa calcium, sodium ascorbate. Now, ang maganda dito sa product ng New Lifestyle C is bukod sa sodium ascorbate being the alkaline vitamin C, you have the zinc, you have the rose hips, you have the guava extract. Kung titingnan natin yung iba't ibang, these are all good sources of vitamin C. Kaya pinapataas niya lang yung concentration ng vitamin C. That's the reason why we call it a combination supplement. No? That will definitely provide multiple beneficial nutrients. It's a form of vitamin C that is easily absorbed and utilized. In fact, studies, generally when we talk of vitamin C, within an hour's time, na-absorb na ng katawan natin. No? Unlike yung zinc, tumatagal yung zinc, no? Sa katawan natin ng 2 to 3 days. Okay? Which is good, of course. No? Sa vitamin C, may lang yung kanyang half-life na tinatawag. Kaya, even if we take it, kaya nga sinasabi ko, what is important is the interval. No? May pagitan naman sa pag-inom. So even if you take a lot of vitamin C, specifically New Lifestyle C, okay na yun. Okay na yun. Okay. Now, ascorbic acid is the main vitamin C. Kaya lang, that's the what? Acidic form, di ba? Sinasabi natin. Ayaw natin yung acidic form. Why? Bakit natin ayaw yung acidic form ng vitamin C? Hyperacidity problems. Yung GERD, yung acid reflux, peptic acid disease, peptic ulcer. Mauwi pa yan sa bleeding peptic ulcer kung saan sumusunga yung pasyente ng dugo. Nung araw, pag sinabi mong sumusunga ng ang tao ng dugo, ang una isipin, TB. Pulmonary tuberculosis, PTB. Ngayon, mas marami sumusunga ng dugo, especially the freshman, bleeding peptic ulcer. Kasi kaya na ulcer, nakayod na yung line. Parang kung sa daan, malaki na yung bako.
Lubak.
Okay? Palalim ng palalim. Sa katawan natin, yung mucosa, yung lining ng ating mga organs. No? Specifically, in this case, yung ating sikura. Pag lumalalim yung uka, tatamaan na yung mga tinatawag na blood vessels. Kaya dumudugo. No? Kasi blood vessels na yun. Kasi blood vessels, veins, arteries, capillaries. Doon yung dumadaan yung dugo natin. No? Wala naman ang dugo natin, hindi naman yun basta walang dadaanan. Nasa loob sila ng uka. Kaya ng Tagalog kasi kung pinagalog ko, you cannot differentiate an artery from a vein, from a capillary. Lahat sila ugat lang. To translate medicine into Tagalog, gaya ng rheuma. There are 3 types of arthritis: osteoarthritis, rheumatoid arthritis, and gouty arthritis. Eh, paano mo tatagulugin yun? Lahat yun, prayo ka lang. Kaya mahirap. That's the reason why sa medicine, there's always the alkaline on the stomach and suitable for those with sensitive digestive functions. Okay? Kasi very common yung hyperacidity problems. No? Siguro dito sa ngayon, more than half of you have hyperacidity problems. Okay? Why? Stress, no, is a factor to consider. The higher the level of your stress, no, yung na-stimulate yung hydrochloric acid mag-produce. So pag nagpo-produce siya, dumadami lalo siya, mas lalo nakakatawa. We need to neutralize. That's the reason why we use sodium ascorbate. Kasi yun ang unang-unang issue sa vitamin C preparations. Meron ka ng ulcer eh. Tapos inom ko pa ng ascorbic acid, lalo pang lumalayo talaga. That's the reason why linipat natin sa alkaline. Because it's an acid neutralizer. Ini-neutralize niya yung acidity sa stomach. Vitamin C is a potent antioxidant that supports immune function, collagen synthesis, and overall cellular health. Diba? Kaya nga uso yung injection eh. Na, ano yung pinaka-common na injection? Oh, it's a combination of vitamin C, collagen, and glutathione. Ano sa mga kababaihan? Gusto, you know, medyo, lalo yung mga artista, no? Gusto nila, so that yung physical appearance nila. Iyon ang punguna nila eh. Pag hindi maganda yung skin nila, hindi sila matatakilig ng tao. So, is the reason why we need to make sure na we also combine it. Whenever you see the word synthesis, that means production. Kasi yung synthesis na term or word, mas inclined na ginagamit sa mga health and medical related issues rather than production. It's important. And overall, cellular. Zinc is an essential mineral, no, that plays a crucial role in many bodily functions, including number one, immune health. The boosting the immune system. Okay? Napakalaking bagay ng zinc. Kaya nga nauso, ihahalo na yung zinc sa vitamin C. Because you're able to increase the strength and the ability of the body, no, to fight off whatever exposure you get into any disease entity. Okay? Wound healing and DNA synthesis. Napakalaga. Kasi when we talk of cellular health and cellular nutrition, you pwedeng mawala yung DNA. Ngayon, everybody knows about DNA. Nagduda ka lang kung ito ba, anak mo kaya o hindi, pag-DNA mo. Alam na kagad. In cases of yung mga medical legal cases, sometimes no parity, parenthood, DNA, because we go deeper into the cell. Before we always talk of cellular health, cellular nutrition. But if we try, say a group of cells compose a tissue, a group of tissues compose an organ, a group of organs compose the human body. So dami-dami, may domino effect. But now, kahit na yung cell, which is the basic unit of life, pumapasok pa tayo inside. So you have atoms, you have molecules, you have organelles that are found inside the cell. So lumalalim na. That's the reason why meron tinatawag ng molecular medicine. Diba? Kasi lumalalim na ng lumalalim. Also supports growth and development. Okay? Okay. Oh, yung parang kanina. Susunod. Now, vitamin C and zinc are commonly taken together as combination supplement because of their synergism. Nagtutulungan sila. Whenever you see the word synergism, nagtutulungan sila. Especially on boosting the immune system. Importante yun. when we talk of the immune system, it's like saying yung resistensya ng katawan mo. So kung halimbawa, sa isang pamilya, merong nagsimulang upunin. After a few days, halos lahat na, meron na rin, nahawa na. Respiratory airborne. Now, that's the reason why ang bilis kumalap ng COVID noon eh. Nung wala pa ng mga measures na dapat gawin para ma-protect ang katawan. Kasi masisingot mo, malalamak mo. Kasi lumilipit mo. Mind you, yung tinatawag natin opportunistic microorganisms, mapagsamantalang microbe. Naka-float lang yan. God made it so na hindi natin nakikita. Kasi kung nakikita natin, the mere sight of these microorganisms na lulutang-lutang, baka himatay na tayo. Now, kaya natin sinasabi na nandiyan sila. Kasi hindi natin nakikita eh, pero kahit hindi natin nakikita, we're sure, nandiyan sila. So, kung labanan na ngayon, palakasan ng katawan. So, kung mahina ang katawan mo, pasok agad yung microbe. Pag malakas yung katawan mo, gusto nila pumasok, hindi sila makapasok. So, that is one of the main issues. Powerful antioxidant. Very, hindi mo lahat. Puro antioxidants na pinag-usapan. Kasi, bakit? That is the one that will eliminate and destroy the free radicals. In any metabolic process, meron na po-produce na free radicals. Kaya nga, free. Libre. And the moment na proliferate yung free radicals na yun, that will affect the system of the body. So, kailangan may pumontra, may pumatay, may pumigil. And that is the role of the antioxidant. And vitamin C is a very powerful antioxidant. Okay? It helps stimulate production of white blood cells. Yung white blood cells ay soldiers ng ating katawan. No? They are found in the blood. Diba kaya pag nagpa-CBC ka, blood count, no? Kita may hemoglobin, hematocrit, NCD, towards the ilalim, you have the differential count. You have the white blood cell, red blood cell. So soldiers natin yan. So pag mataas yung count, ibig mong sabihin, may infection siguro yung tao. But as to where, sometimes we don't know. Coupled with the urinalysis, nakita mo mataas yung WBC. Siguro may UTI. You always say, pag sinabi may UTI, urinary tract infection. What? It can be in the kidneys, it can be in the ureter, it can be in the blood. Lahat naman yun, urinary tract. So it doesn't matter. And the purpose is to correct the problem. So, of course, still, the antimicrobials will always be very helpful in fighting off infection. Vitamin C also promotes the production of antibodies. Panlaban na naman. Okay? Kailangan natin ng antibodies to support the body's natural defense mechanism against pathogens. Pathogens, yan yung mga kalaban ng katawan natin. Microbial, toxins, and all. In fact, ngayon, we have what we call the 5 pillars of clinical strength. Namely, una, diagnostics. Meron din yung mga ibang paraan of how to come out. Ano yung problema ba ng pasyente? You need to pinpoint. Ano ba yung, kaya na, sinasabi ko, pag yung mga doktor ay parang kami, NDI agent, iniimbestiga na of immune cells and strengthens the body's ability to fight off infections. Kasi dalawang bagay lang yun. Either manalo tayo against sa mga kalaban nating mikrobyo or matalo tayo ng mikrobyo. No? So, hindi tayo papatalo. No? Kaya importante lagi handa. No? May sabi nga sa military, combat ready. Anytime na may lulusob na kalaban, kailangan ma-repair natin. ZINC is also supports the healing process of bones and bones involved in subdivision and growth. Kaya napakahalaga yung mineral na zinc. Taking vitamin C with zinc can enhance immune health, provide a approach to supporting overall well-being. Pinag-usapan natin dito yung sodium ascorbate, alkaline form of vitamin C and zinc. What about the other ingredients? Roses and guava extract. Yun. So, the combination of these nutrients are depending on individual needs. But generally speaking, you should always be taking a minimum of 4 to 6 capsules a day. Minimum. Meaning kung mas mataas po nun, fine. Hindi na, kaya ako sinasabing it's very safe. Simply because meron kang umaga, meron kang tanghali ng hapon, meron kang gabi. So you don't need to worry about ito, baka sumobra, ito ang susunod. Kasi wala na tayong vitamin C sa katawan. That's the very reason why you need to emphasize the importance of mega dosing. Importante yung mega dosing. Kasi kung isa, dalawa, nag-accelerate. Ideally, 30 minutes before meals or 1 hour after meals. That's the ideal. Again, when we say ideal, yun sana yung standard. But any time of the day, you take action. Anti-aging. Yung aking, kanina yung sinasabi ni i-introduce ako. Kasi gusto kong malaman kung ano nangyayari sa Pilipinas. But sometimes, nakakainis because of hina-highlight mga negative news. Patayan, aksidente, which is nakakapagil. Anti-inflammatory, anti-stress. Sabi ng iba, marami, hindi lang iba, maraming tao ang nagsasabi na doc stress ball. Wala nang hindi na stress. That's a given thing. That's part and parcel of our daily living. Kaya nga may stress management eh. Importante na ma-manage natin yung stress. Kasi meron yung stress concept. No? Halos lahat ng ngayon stress-related. Eh kung yung bata na may mga assignments na, may mga quizzes, na-stress din sila. Tayo pa kaya mga adults na hindi na-stress. So, arsenic sa mga gadgets. Hindi na tayo mabubuhay kung wala cellphone. Nung araw nga kami, yung pocket girl. Tutulog. Nasunod ka ng sinihan. Tutulog. Ang pira na ito, napaka-big lang. Or doctor, you are needed and you have an emergency. Mabuti pa, ngayon, at least, sa text ka lang. Wala nang makakaalam. Ito, sa text mo lang. But that's part of digital technology. Nag-i-evolve. But the point is, yung exposure din natin na dati-dati. That's the reason why yung iba sabihin, dapat na akong kakasakit. Mainit na ako. It can kill a person. So, yung exposure natin, yun na nakakatawag, yung tinatawag na heavy metals. That's why we need to detoxify. Slimming and weight management. Again, everybody wants to be slim. Everybody wants to be in shape. Sabihin ng iba, uy, ang ganda niya. Pero mataba na yan. Kawawa naman yung mga mataba eh. Pero yung sinasabi siya, uy, hindi siya kaganda, pero ang sexy. Wow! Diba? So, it matters. That's the reason why importante na bigyan ng pansin. And that's also part of the kaya nga, sabi lang, new newlifestyle ka na. Tapos physical fitness ka. Kasi ngayon, even mga kabataan, ang nagiging sakit ay obesity. Sa Amerika, number 1 problem is obesity. Why? Walang physical living. Walang physical activities. Ako ayoko lang gamitin yung word na exercise. Kasi parang mas may pressure eh. Physical activity, ako lang makapag-exercise. I have a treadmill at home. Hindi ka na nung pandemic, halos araw-araw ko ginagamit. But no, I don't have time. I don't have even time to do workouts. Noon, nag-gym pa ako. Ay, wala na. So what do I do? Walking. Brisk walking. Kahit minsan sila ng bahay na 30 minutes, that helps. But it has to be taken. And it has to be done every day. Anti-BAIRA. Kaya nga, naging popular ang vitamin C because of the anti-COVID. Okay. Any questions at this point?
Kasi meron.
So, some of the conditions
Kasi
no,
meron.
that will benefit from taking it. Halos lahat nandiyan. Siyempre, nuna natin cancer. Noong araw, ang ayaw ng pasyente magkaroon ng TB. Kasi may mayroong stigma. Kasi nung araw, nung panahon ng
Ay, ano ba yan?
Espanyol, when we were under the Spanish regime, tagal natin under the Spanish regime.
Yes.
Ang mga Espanyol, aristokrata. Ang tingin sa Pilipino, bakit?
Madumi.
And pagka ikaw ay na-labelan na may TB, sabihin mo makakagwas mo tao. You are economically poor. Kaya, walang taong na-extra ng TB. Pero sa ngayon, magka-TB ka na, huwag ka lang makaka-cancer. Diba? Kasi
Yes.
dali-daling na gamutin ang TB.
Cancer.
Kailangan lang ng continuous regular taking of the medicine. Sometimes you have to take the anti-tox treatment about 6 months, the most 1 year. Pero for sure, gagawin ko. Ang nakakatakot cancer. Lalo na if you catch the cancer quite late. Okay? So diabetes, heart disease, gout, bronchial asthma, coughing colds with the influenza, arthritis, leptospirosis, no? Bronchitis, diarrhea, pneumonia, cataract, malaria, tonsillitis, lahat na yan.
Degenerative.
Of course, hindi naman natin sinasabi. Na kapag ka meron ka, nagsisimula ka ng ito, inom ka lang ng vitamin C o okay. It's more on trying to prevent the occurrence of these diseases. Okay? Next. Yan, sinasabi ko. The half-life, sodium can vary, but generally, vitamin C has a short half-life, about 30 minutes to 1 hour. Ang kuminom pa, after about 1 hour, siguro, alis na wala na yung vitamin C concentration sa katawan. That's the reason why pwede kang mag-take na mag-take. No? Now, yung zinc can even last for 2 to 3 days. Now, ang tanong, Doc, pag uminom ako ng new lifestyle C, may zinc yun lagi, hindi ba mag-accumulate sa katawan? Hindi. Kasi hindi naman ganun kalaki yung milligram content or concentration ng zinc. Mas malaki pa rin yung vitamin C, sodium ascorbate. Now, yung rosehip and guava extract are natural sources of vitamin C. Nakasama dun sa ating produkto. So, dinagdagan mo pa na importante yung other benefits. So, rosehips are fruits of the white rose plant that are known for their high vitamin C content. So, madadagdagan pa yung vitamin C natin because of the rosehips. They also contain antioxidants and anti-inflammatory. Bakit ba madalas nyo nakikita sa airport na sa kayo ng anti-inflammatory? Halos lahat ng sakit starts with an inflammation. Kaya nga, yung mga may word na itis sa likod, sa huli, bronchitis, diba? Pneumonitis, cervicitis, tonsillitis. These are conditions or diseases that started as an inflammation. Namaga. Lumala yung pamamaga ng sakit. Okay? So lahat yan may inflammation. That's the reason why it's very important to emphasize with potential benefits associated with rose hips. No? So, immune support, rose hips. Kasama yung so if you try to look at the label of our new lifestyle C, meron siyang rose hips, guava extract. Aside from sodium ascorbate and zinc. Okay, so multi-component. No? Mas maraming component, mas maganda. So, immune support na naman. Wala lang kaduda-duda. Joint health. Some studies suggest that rose hips may help reduce joint pains. Hindi kaya, Dok, kung meron yung maya tao, tayo natin mga daliri, yung mga daliri sa paa. Particularly in conditions like osteoarthritis. Pagka ako tumatanda yung tao, nagkakaroon ng may inflammatory reaction, meron pain, that is osteo. To the bone. Okay? Osteo means bone. Arthritis that you develop in the bones. Kasama na siyempre yung joints and ligaments. Okay? Skin health. Antioxidants in rose hips may have a positive effect on the skin health and may help protect against skin damage caused by free radicals. Okay? Kaya nga, hindi ka pwede. Bihirang Pilipino ang nagkakaroon ng cancer of the skin. Why? Because meron tayong melanin pigment. Yung hindi na nagpapitin. Medyo dark colored because of that melanin pigment, which is protective, no? To protect us against skin cancer. Sino ang malimit na nagkakaroon ng skin cancer? Caucasians. Yung mga puti, Europeans, Americans, nagsasunbathing, upat, exposed nila. Tayo naman baligtad. Gusto natin puti. Not realizing na yung kulay natin protection natin.
Yes, pinagpala.
Colonial mentality kasi minsan. Oh, guava naman. Guava extract. Tropical fruit rich in vitamin C na naman. Okay? Fiber and other nutrients. Also possess antioxidant and boosted. So, pinagsama-sama mo sila. So, mas maganda yung magiging effect. So, the combination, sodium ascorbate, zinc, rose hips, and guava extract in a single supplement, new lifestyle C provides a comprehensive blend of immune supporting antioxidants and nutrients. So, hindi na tayo makakawala sa immune boosting effect. Kasi yun ang bibigyan sa something, just like what happened in COVID. May help strengthen the immune system, support collagen synthesis for healthy skin, and provide overall health benefits. Also be aware of potential interactions and contraindications. Okay, wala namang problema, gaya ni sabi ko, na pwedeng ihalo yung vitamin C. No? Kahit na anong maintenance meron.
Yes.
As much as possible lang, huwag sabay-sabay. No?
Okay.
So if you take new lifestyle vitamin C, no? Make sure na meron man lang kalahating oras na interval.
Yes.
Or better still, 1 hour from taking your standard maintenance. Why? Hindi mo kayo disgrasya. Except that the chemicals that are inherent in the synthetic medicines will allow an interaction, mapapababa yung full strength ng ating new lifestyle preference. So sayang. Siyempre, gusto natin lagi mataas, maximum, optimum level of ating vitamins. Okay? So, it can be taken, no, with other medications. Okay, so guava, again, kung makikita niyo, bakit kasi ganun nga yung purpose niya, no, para magkaroon ng additive and synergistic effect. Okay? Fibers which can help support digestive. In fact, there are studies showing na yung guava, mas mataas pa yung vitamin C content kaysa sa ordinary oranges.
Yes.
or lemon. Maganda yung GLUTA. Antioxidant properties, of course, to protect against cellular damage caused by free radicals. Okay?
Taking an excessive
So,
naman.
take an excessive amount.
Oh,
Nobody is taking so much of it. Kaya nga sabi ko, kahit mag-megadose, no? 3,000 milligrams a day, divided doses, you don't need to worry about it. The most you can have is diarrhea, nausea, nasusuka. Wala pa akong nakita, or stomach cramps. Zinc toxicity can occur with excessive intake and may result in symptom, nausea, vomiting, and copper deficiency. Pero, maliit lang yung content ng zinc dun sa new lifestyle C. Okay, you don't need to worry. Interactions, okay, interact with certain medication affect absorption or excretion of vitamin C. So yung kinatatakutan natin na baka magkaroon ng interaction, pwede lang makapekto sa pagbaba ng absorption rate and excretion, but not something that will lead to serious problem. FAQs. Frequently asked questions. Instead na ako magtatanong sa inyo, kasi the typical thing is, do you have any questions? Wala. Wala nagtatanong. So ako na yung gumawa ng question. Okay? No, question. Sige. Good. The question. Sige. Sino may question? Sige. Wow. Okay. Question muna. No, ano dapat ang dose ng vitamin C at GLUTA pag ang isang tao ay wala nang kinalaman ng spleen? Bakit nawala? Sino yung... bakit nawala ang spleen? Splenectomy? Very old. That's not the reason. Kasi okay, ganito. Ang spleen, kung yung tanong kung ano yung tagalog sa spleen, i-very ko lang. Yung spleen, pagka na-aksidente ang tao, vehicular, o kung ano yung bodily accident, kalimitan na unang tinatamaan yung spleen natin. Yung spleen, ang siyang, hindi abdomen. Ang spleen ay may kinalaman sa pagproseso ng ating dugo at yung drainage ng ating dugo sa lymphatic system. Okay? So, bihirang-bihira, unless sigurado kayo na tinanggal yung spleen. Kasi hindi yung basta-basta tatanggalin. Unless the damage, pumutok, sumabog, nagdugo, that's the only time you take out the spleen. So, I don't think, hindi naman sa no, pero hindi ko na parang nahihigaw. I'm surprised with natatanggal yung spleen. But just the same, hindi siya magkakaroon ng effect. Even if you take 6 capsules or 3,000 milligrams of that is. So, ano vaccines ang kailangan ng taong natanggalan ng spleen na naman? Wala naman particular vaccine para sa spleen. Ang vaccine ay may kanya-kanyang silbi kung bakit. Just like nung may COVID tayo, nung pandemic, no? Yung mga vaccines na pinroduce is against the COVID-19 infection. Pero we don't have any vaccine in particular that will answer the call for natanggalan ng spleen. Okay, ganito ho, no? Ako ang tulong ko sa pasyente. I understand that so many patients are not given the benefit of a good explanation from their doctors. So pag tinanong mo, hindi nila alam. So, minsan, nahihirapan din sila ng tanong. So, Doc, hindi ko alam kung tatanong ko. Hindi ko alam kung ano naging problema ko. So, what I usually do is I ask for the medical abstract. A summary of your medical condition. Kailangan ko mabasa. Dahil pag nabasa ko yun, alam ko na kung anong kondisyon nyo. At ako na mismo magpapaliwanag sa inyo. Because I don't expect patients to be able to explain what they really wanted to find out. Okay? So ito, medyo pasensya na po, hindi ako wala ko na, pero hindi ko maintindihan kung bakit dapat nawala yung spleen. Okay? Iba yung spleen, iba yung gallbladder, iba yung appendix, okay? Baka nagkalo-halo. Doc, what is the RDA of zinc for kids? It's treated. Yung recommended dietary allowance, RDA. Kung titignan natin, no, sa mga articles, ang vitamin C nga what? Wala pang 500 milligrams ang RDA sa isang araw. But we defy that. No? Unang-una, yung sa atin, kasi pag sinabi mo, generally speaking, when you talk of vitamin C, you are referring to the ascorbic acid thing. Sa atin, sodium ascorbate. In-alkaline na natin para non-acidic vitamin C.
Yes.
So, yung RDA, we don't adhere to the RDA. Kasi pag tinignan mo yung recommended dietary allowance ng vitamin C, less than 500 a day. Nakita naman natin, wala na silbi. Ako na nagsasabi sa inyo. So if you only take one, pinipigil nyo. It's either you take mega dose or wag nyo na lang mag-take. Wag na lang kayo mag-take. Sayang na. Okay? So, we don't recommend it to be taken by kids. Okay? Yung zinc natin for kids, I'm not so sure, to be honest about it. Kasi meron tayo, kaya nga tayo meron mga pediatric preparations. Yung mga solutions, suspension. Because these are really for kids, especially kung 3 to 10 years old. Okay? Even vitamin C na eh. Di ba? Meron mga syrup form, suspension. Kasi yun lang kaya. And usually, this syrup or suspension form, mas mababa. So, for example, yung 500 milligrams natin na capsule, in syrup form, they usually will have it 125 milligrams per ml, per 5 ml. Alimitan ng preparation. So, hindi na natin you don't need to give a child in 3 to 10 years old kung wala namang indication of reducing preparation. So what we're talking about here, our new lifestyle C, is really recommended generally for adults. Or kung bata man, siguro I would say 12 and above. Kung kakit lang yun. Kasi by that age, medyo nagmamature na. Younger than that, I don't think we will. Okay, ayun nga, yung sinabi ko, for adults, huwag na natin sundin yung RDA. You don't need to follow that. Magpasa kayo. No? Ang RDA, ang recommended daily dietary allowance, daily allowance, sa adults, is less than 500 milligrams. Walang kwenta yun. Walang kwenta. Okay, so you do it higher. What is the effect of too much zinc? Siyempre, kaya nga sabi natin, because the usual things, just like yung pahinga, ano yun? Okay? Diarrhea, nausea, susuka, parang pasusuka, abdominal discomfort. Wala namang serious medical condition when you take it too much. What is too much? Sabi ko nga, kahit pa 6 capsules of our new lifestyle C, you can take it. Okay, so yung RDA mo na, because nalilito lang tayo sa RDA adults and kids. But, Doc, is vitamin C with zinc enough vitamin C to have a healthy body for kids and adults? Pwede naman. Okay? But the reason why we're taking big complex, diba? Sometimes, sinasabi natin for the nerve vitamins. So if you have problems with your nerves or then you can add. Kaya natin ini-emphasize kung gaano kahalaga yung vitamin C is simply because yun ang standard natin, yung pinakamagandang vitamin preparation. Now, if you're taking some multivitamins, can you take it with the lifestyle C? Of course you can. Walang interaction when it comes to vitamin C. What other vitamins, minerals do we need? Kompleto na yun eh. So for us, you don't need to take anything. Kasi very encompassing. Broad na yung vitamin C. No? That's the reason why it's the most popular, it's the most utilized vitamin preparation in the world. Though ano dapat ang dosage nila? Pag isa ka ay wala.
Mamaya na yan.
Okay? So,
Mamaya na yan. Mamaya na yan.
sige, alin muna natin ito. Because these are questions na importante. Okay? Say for kidney stones. It is. General has been proposed as a risk factor for kidney stones because it may increase urinary oxalate. But since we are using sodium oxalate, mas safer. Kaya yung iba, gumagamit calcium ascorbate, mas nakakatakot. Because kahit na yung ordinary calcium na ginagamit, may mga calcium A, calcium in the market ito, hindi rin pwede marami. And the proper way of taking calcium is to take it with either vitamin D or vitamin K. Kasi bakit? Calcium when taken inside the body, okay, dapat pumunta sa buto. Because the calcium will make the bones stronger. But the point is, without D3 or vitamin K, maraming calcium pupunta sa kidneys. And that will create the formation of what we call calcium oxalate crystals na pwedeng mapunta or mauwi sa kidneys. That's the reason why kailangan maraming tubig. If a patient is suffering from some kidney diseases, like CKD, you can still take it. Kaya lang, hindi na tayo mag-dose. Bababaan natin yung dose ng vitamin C. These vitamin C is also very good for people suffering from acid reflux. Again, okay, acid reflux or blood gas disease. Ito, generally, kung hindi, sa atin sodium ascorbate, alkaline form. So, we are able to neutralize yung hyperacidity problem. So, it's very safe for acid reflux. Kawalaan. You can take it after meals. Kasi yung iba, very sensitive yung sikmura. Ilagok, kung yung vitamin C, mo, masal sikmura ko. So, okay, adjust, take it. You take it immediately after meals. Para magkaroon na. The only reason why you take certain medicines or supplements before meals is mas mabilis yung effect. Kasi walang kasama pagkain.
Yes, yes.
Okay? Pero kapag after meals, umabagal yung effect. Kasi may kasama
Kailangan
pagkain.
wala
But for very sensitive digestive tract, sabihin natin, history natin, GERD, acid reflux, hyperacidity, ulcer, then it's still safe to take it. No? Make it to take it after meals. Okay? It doesn't matter. Babagal ang effect, pero i-effect pa rin. Okay? Is zinc good for the kidneys? Several studies underline the critical role of zinc in reducing oxidative stress levels, which is considered the common denominator mechanism response for progression of kidney disease. So, zinc in itself will not harm you. Yun na yung sagot natin. Remember, yung amount ng zinc is very small in our newlifestyle. C. Okay? Isinama lang siya in order to make sure na mataas yung control na yung effect na for immune system. Immune system boosting. Okay? Vitamin C, does vitamin C lower creatine levels? Generally, it improves the endothelial function of kidneys and enhances creatinine clearance. Kasi, di ba, sa sobrang dami ng problema ngayon sa kidneys, ang laging tinitingnan natin creatinine because creatinine is a kidney function test to find out basically meron bang problema sa kidneys because ang unang tatamaan yung creatinine level. So, pag tumataas yung creatinine level, it somehow tell you na, oy, baka may pwedeng kidney problem. So, that's the reason why may EGFR pa naman. Estimate EGFR, estimated glomerular filtration rate, which means yung ability ng kidneys to take out the toxins inside the body. That's the reason why ito pa. Okay. So, ano ba ito? Board marker. EGFR. So ngayon, pagka nag-request tayo ng creatinine level, sesi na kayo, napakaganda ko sa creatinine and BUN. Pero the concentration is really on creatinine. These are kidney function tests.
I see.
So pag mataas sila, no, chances are may difference yung
Kidney
kidneys.
function.
Pero
Creating.
ang
Creating.
difference ay it just gives us an idea ng parang nowadays, sinasama na natin yung EGFR estimated glomerular. When you say glomerular, it's something to do with kidneys. Kasi glomerulus is part of it. Glomerular filtration rate. GFR. Ay yung ability ng ating kidneys to get rid of toxins. Kasi kung hindi matatanggal ng kidneys natin, yung toxins na katawan natin, delikado, nag-accumulate, ayaw natin. Okay? So, endothelial function ng kidneys, meaning the physiologic, yung normal function ng kidneys. So, nakita naman, yung enhanced clearance. So, pagka ngayon nagpapakita na nag-request ng blood chemistry procedures aside from sugar, total cholesterol, triglycerides, LDL, HDL. So, kalimitan kasama yung BI. Binibigyan natin ng focus kasi importante malaman kung ang kidneys natin ay okay. Okay? Is vitamin C good for the liver? Remember, the liver is a major detoxifying organ. Meaning, siya yung filter. Siya yung nagsasala ng dumi na humahalo sa pagkain natin. Pag siya yung dumi, hindi naman literally yung dumi. Kundi minsan chemicals, preservatives, no? Kasi sa negosyo ng food, kailangan mapatagal mo yung buhay ng pagkain kasi kung hindi, malulubi ka pag hindi naubos. So they put a lot of this. Even spices. These are toxic to the body. So, pinifilter niya, tinatanggal niya, hinihiwalay niya. And that is the work of the liver. Kaya nga tinawag siyang major detoxifying organ. And there are different types of liver diseases. Sabi ko kanina, fatty liver is now getting to be very common. Dito siguro sa inyo lang. No? Siguro more than half of you may fatty liver. Paano natin malalaman kung may fatty liver tayo? Through what? Ultrasound. Makikita yun. May fatty liver. Pag laging mataas ang cholesterol nyo, triglycerides, LDL, chances are may fatty liver. May fatty liver. 90% problem. Kaya nga importante, tinitingnan natin, binomonitor natin. It's not only the sugar, yung cholesterol. Kasi yung sugar, although yung complications ng diabetes, nakakatakot at pwedeng pumatay sa tao. mas mauna pa yung complication sa mataas na cholesterol. Because pagka mataas ang cholesterol, triglycerides, yung tinatawag natin lipid profile test, pwede kayo atakihin. Mag-uunahan lang sa puso ba, puso. Iba yung stroke, iba yung heart attack. Okay? Mas maliit stroke, kinamamatay ng tao kasi mas makikipot yung mga ugat na dinadaloy ng dugo sa utak o sa puso. Minsan yung deep vein thrombosis, DVT. Namuo yung dugo sa may paan mo. Nadala. Yung blood clot, hindi naman kailangan maging malaki. Kahit maliit lang. Namuong dugo. Madadala yun ng dugo pa rin. So, maaaring bumala dito, maaaring bumala. Kaya lang, kung maliit lang siya, mas may tendency babala sa utak. So, mas maliit yung mga ugat natin sa utak. At depende sa tatamaan parte ng utak. Because the brain is a very complex organ. Kaya nga nagkakaroon ng paralysis, right-sided paralysis, left-sided paralysis, may slurred speech, minsan upper half, lower half, or quadriplegia, kaliwa, kanan, taas, baba. Wala na. Depende sa tatamaan. Ang masakit nun, there are two types of stroke. Ischemic stroke, bumara lang. Hindi namatay yung pasyente. Kalimitan may paralysis. Ang masakit, hemorrhagic stroke or ruptured aneurysm. Pumutok na. Bakit pumutok yung ugat? Malutong na eh. Kasi nag-deposito na yung plaque ang tinatawag, cholesterol deposits. So, instead na flexible siya, elastic, malutong na. So, pag akyat bigla ng blood pressure ng tao, what they form up. That is what we do. So, the precipitating factor, ano yung nagbibigay daan kung bakit na-stroke, na heart attack ng tao, is hypertension. Kaya, you can never be complacent. Hindi kayo pwede magpapel-expect sa although yung blood pressure ko 130 over 8 lang. It's not. Because your blood pressure can change. Even if you take your blood pressure for 10 times a day, for sure may bago-bago. Kasi emotions can affect your blood pressure, usually pataas. Nagalit ka, kahit na natuwa ka ng sobra, na-excite ka ng sobra, pwede tumaas yung blood pressure. And if that happens, yun ang pwedeng panggalingan ng either cardiovascular disease, stroke, or you will never know when it will come. Kaya nga, ang mahirap to, hindi mo alam kung kailan darating, hindi mo alam kung when to expect it. Darating ba o hindi? Kailan ba darating? Paano mo mapapaghandaan ng isang bagay na hindi mo alam kung kailan darating? So you need to be proactive. Always be health conscious. Na, uy, at any time, iba nga natutulog lang eh. Hindi na nagising. Inatake while at sleep. Okay? Yung TIA, transient ischemic attack. That is what you call mini stroke. Hindi mo mapapansin. Malimit, mapapansin nyo kung may kasama ko iba. Paano wala kang malay? Just for a few seconds. Of course, hindi ka maano. Pero that alone is already telling you something na you might get into a full-blown stroke later on. You don't know when. Nobody knows. Kaya kailangan dapat. Parang Boy Scout. You need to be lagi handa. Okay? If I'm good for kasi non-alcoholic fatty liver. NAF. NAF. Meron din alcoholic fatty liver disease. Mahilig din ng alak. Marami. And ngayon may pangatlo na hindi pa lumalabas sa na research ko na. Metabolic syndrome associated fatty liver disease. Ano yun? Yung metabolic syndrome, malaki yung waistline mo. Sa lalaki, if it gets beyond 37 inches, hindi naman yun. Sa babae, if it gets beyond 31 inches, hindi naman yun. Okay? So, sama-sama yan. Waistline, okay? History of diabetes, blood sugar, history of hypertension, and hypercholesterolemia. Package din na rin yung sakit ng tao. Hindi lang package din sa mga supplements. Nakasakit ng tao. Does zinc help in acid reflux? Zinc itself has been found to be significantly better than omeprazole at combating stomach acid.
Combating stomach.
Of course, pag sinabi mo yun sa mga pharmaceutical companies, magagalit. Hindi. Hindi totoo yun. In fact, yung chelation, kung natidinig mo yung chelation, it's a detoxification procedure. It's now being considered a substitute for angioplasty or coronary artery bypass. Wala, lahat ng cardiologists at cardiothoracic surgeon kukontrahin ka. Pektuhan yung kanilang
Hanap buhay.
How much is a kabis ang tawag ng CABG, coronary artery bypass. Yung bypass operation. Depende. We're talking of millions na kanya.
Walang tipikan.
Samantala yung chelation, how much is it? Like packages na. 10 would be probably between 50 to 70,000. So one session would be around 5 to 7,000. You can see that it's high in the price. Pero yung purpose pa rin lang. Kaya ako, sometimes I am invited to talk among fellow doctors. Yung nag-invite sa akin, silang tanong ko, yung bang audience ko ng mga doktor open sa alternative integrity? Kasi kung hindi, huwag na lang. Baka mag-away pa tayo. Pero kapatalo, so last month, I was in Iloilo and Bacolod. Anong audience ko in both events? Doctors of medicine. But before I said yes to the person that invited me, sabi ko na, open ba ang mga doctor? Who is that? Noong dinag-lecture na ako about diabetes, do you have any questions? Siyempre, iba yung lecture ko, kapwa doktor, because we say the same language. Wala. Ang meron tanong doon sa business sa kitaan. Siyempre, sino ba naman ayaw na kumita ng mas malaki? Yes! Because everybody. Kaya lang, ang sinasabi lang natin, we're trying to bring the focus on the health issues. Para mas maganda pa. Diba? Mas grateful pa yung kukumbinsihin mo. Kasi tinutulungan mo yung kalusugan niya. Kunyari na lang, nasa secondary yung kitaan. Pero totoo yun ang unang primary consideration. Ano lang yan eh? It's just a matter of approach. Diba? Sabi ko na, sodium muscovate can be on an empty stomach. Yes. Recommended food minimize the risk of stomach upset. So it can be, there's no hard and fast rule when taking the supplement. Kung sinasabi nga natin yung reason, the only reason why a lot of times you would need to take it on an empty stomach, mas mabilis yung effect.
Yes.
Okay? Kasi pag may kasamang pagkain, medyo bumabagal. But just the same, i-epekto pa rin. So if you have the history of acid reflux, where peptic acid disease, peptic acid, it's beautiful. Oh, okay? Be taken long term. They can be taken for long term use. Depending on the one health of the status. Kaya from time to time, ako, malimit kong sinasabi. Merong pre and post. Pre-examination. Ako pa na mag-start. Kaya ka start mo plan, pa-check mo. Again, just like what I said earlier, documentation is very important. So, tinignan mo yung blood test. Alam mo na, mataas na yun. Okay? And then, you take supplement. After about 6 months to 1 year, then you repeat. Find out. May changes pa, may improvement. Huwag naman yung isang buwan pa lang, ulitin ko na. Dito mo expect. We're not making magic. So, it has to be on a longer period of time. Okay? It can be taken long. Yeah. I've been taking it for siguro roughly more than 10 years. Kaya ako ganito pa sura.
Ay, tapos na.
Meron pa yung yung GLUTA? Yeah. Ready na ba? Ready na. Okay. Sabi mo nga kanina, in the beginning, vitamin C, GLUTA tayo, sa collagen. Lagi silang kasama. No, so now,
Vitamin C pa lang. Kasi GLUTA tayo.
okay? So, why GLUTA tayo? Ano yung una lumalabas pagka GLUTA tayo? Uy, puputin. They never say that. They never say that. Because that's not a guarantee. The more important issue in glutathione is its being a master antioxidant. Okay? Mas maganda. No? Yung whitening effect is considered a side effect, a good side effect. Pero you don't even, kung sasabihin mo siya, Dok, gusto kong pumunti eh. Ay araw-araw, sasasama kita ng glutathione. Siguro naman, napuputi ka. But the oral preparation, swerte. Kasi it will always depend on your individual body reaction.
Tama.
Kasi ma'am, iba yung reaction sa katawan.
Yes.
Iba pa rin.
Yun ang sabi niya. Tama.
And that is something that you cannot predict. Okay? Ayan. Yan. Okay, so yung ating new lifestyle, glutathione with collagen. They almost always come together. Glutathione and collagen. Okay? 60 capsules. 30 ba? Sorry.
60 ang nandyan, 30.
Ano natin? Nagkano? Okay? Wait, ayaw. Napagod na. Yun. So, the glutathione is the body's most important antioxidant. That's the very reason why it was called master antioxidant. The mother of all antioxidants. Just imagine, meron na tayong vitamin C in the presence of new lifestyle C. Sinamahan mo pa ng glutathione. So, parang kung dinodoble, tinitriple, tinitenize ang antioxidant. Kaya that will be protective yun. It will provide the necessary protection. Yun ang isang mahirap i-convince ang tao. Yung epekto sa internal organ, hindi nakikita. Dok, iba yung, uy, pumuti ako, uy, kumilis ako, kita mo. Pero alin yung papatay sa'yo? Yung diferensya mo sa loob ng internal organs mo o yung physical ka? Kahit ikaw pa yung pinakamaganda, pinakagwapo, ilalang. Kung may diferensya naman yung katawan mo sa'yo, mas gusto.
Yes.
So, we give more importance yung internal organs.
Yes.
Kahit hindi natin nakikita. Molecules made up of amino acids, L-cysteine,
Kasi may...
glycine, and glutamic acid. Yan yung basic 3 components ng glutathione.
Hindi, kasi gawa nung ano. Hindi makaroon. Hindi pwede kasi yung
Crucial for
camera.
cellular
Wait lang.
detoxification.
Yung camera kasi.
So, cleaning, cleansing the body. Liver health, heavy metal transport out
Dalawa yan.
of our cells.
May nawala pa sa ano.
Oxidative
Duman na.
damage.
Kahit na kasi kung mawala yan sa ano.
Importante yan. Kaya nga tinawag siya master antioxidant.
Wala.
Ito, di ba? Yeah. Okay.
Essential.
Antioxidants are needed to protect cell integrity and to fight free radicals possibility. Pareho na rin yan ang ginagawa ng vitamin C. ng new lifestyle CEE. So, nare-reinforce na dadagdagan yung ating antioxidant effect. In fact, that's the reason why it was called master antioxidant. Kasi siya yung sabihin na natin, powerful antioxidant preparation. Okay? The glutathione. Helps to detoxify, eliminate poisons, toxins, liver, lungs, intestines, and at the same time, the conjugation of glutathione with toxins helps detoxify and eliminate fat-soluble toxins and everything. So, ano ginagawa ng glutathione? Yung mga toxins sa katawan natin come in the form of fat-soluble. Ibig sabihin, mas ma-eliminate natin siya kung i-convert natin siya to water-soluble molecules or substances, no? Or toxins. Kasi, i-direct ng glutathione papunta ng kidneys. And from the kidneys, ilalabas natin through the urine. Okay, so may exit point. Okay? Kasi kung sa taba, baka mag-accumulate lang sa liver. Okay? So kailangan ma-convert natin siya from fat-soluble to water-soluble. Okay? Para madala natin yung dumi, yung toxins, yung heavy metals sa kidneys. And from the kidneys, iihi natin papalabas ng ating ito. So that, ang importante, yung kidneys natin are in its optimum level. Wala siyang depression. Kasi kung may depression niya, we don't expect na mailalabas yung heavy metals and toxins na maayos. Okay? Yung glutathione is the most critical and integral part of your detoxification system. Kaya nga yung word na detox ngayon is getting to be very popular. Detox. Meaning cleansing, removal of these toxins. All the toxins stick onto glutathione, which then carries them out through stool or urine. Kung hindi man sa ihi, sa stool, sa dumi. Kasi yung ibang fat-soluble toxins, hindi natin ma-convert into water-soluble. So fats pa rin siya. Siya naman yung pupunta sa ating colon, to be eliminated through the stool, sa dumi. Okay? Yeah. Expected effects of 4-week oral trial to. Oral glutathione, 1 gram, which means 2. Kasi 500 milligrams. Depende on preparation. Merong 100 milligrams lang. So 100, 10. Kung 500, is 2. In clinical trials included, increased energy levels, elevated immune system, and better metabolic function. Pag pinag-usapan yung metabolism ng katawan ng tao, yan yung typical na may magsasabi, Dok, mataba, obese. Dok, halos mo na lang kinakain. Bakit hindi ako mapayat? Very slow ang metabolic process. On the other hand, yung isa naman, sobrang payat. Dok, lahat na lang kinain ko. Bakit hindi ako tumatawa?
Mayroong ganun.
That is the metabolic process. Yung build up and breakdown of substances. So, it has something to do directly with the thyroid. I always say that the thyroid is the most neglected organ of the body. Kasi bakit? Ang alam lang ng tao na depression sa thyroid yung bosyo, goiter. Hardly do people know about hypothyroidism, hyperthyroidism, puro bosyo. Kaya, samantalang ang thyroid is the organ principally involved in metabolic process. Okay? So, yun. Kaya pag hindi kayo pumapayat, despite the fact na kukunti na lang yung kinakain yung carbohydrates and fats, you need to move, exercise, do some walking, brisk walk. Huwag na yung para sa ilalim ng yun. Pag medyo
Nabilis. Para
and
pawisan.
if that is the physical activity that you do, you have to do it on a daily basis. Kasi medyo passive yun. Na kung nag-workout ka, nagka-treadmill ka, then you can only do it 5 minutes a day. Every day. Okay? So depende sa physical activity. Okay, Dr. Mark Hyman is a very popular and famous doctor. Para rin siyang integrative medicine doctor. Sabi niya, the most important molecule you need in order to stay healthy and prevent the effects of aging. Gusto niya na, okay, meron tayong tinatawag na biological age na ikino-compare natin dun sa tinatawag na chronologic age. Ano ba yung chronologic age? Yung edad natin, based on our birthday.
Alzheimer.
Unfortunately, every year, tumatagdag yun. Yung biological age na tinatawag is the age of your cells na pwede natin i-modify, meaning pwede natin pabataan. In fact, we're using a machine sa European wellness. Nadidetect niya yung biological age ng tao. Okay? Unfortunately, gusto natin mas mababa yung edad natin biologically. Para na sa ganun, mas bata yung cells natin. But in reality, mas mataas pa minsan. Isa 50 years old yung pasyente. Chronologically, based on the birthday. Tapos yung biological is just 60, 65. But, that is not a death sentence. So we can do something about it. Detoxification, repair, rejuvenation, may mga procedures na ginagawa para bumata yung ating cells. Pag bumata yung cells natin, chances are mas hahaba yung buhay natin. Naturally. Kaya nga, longevity. Paghaba ng buhay. So, in order to stay healthy, prevent aging, cancer, heart diseases, dementia, Alzheimer's. Pagka-Tagalog, baduy. Ulyanin. Pagka-English, wow, classy, Alzheimer's. Pero sa Kinagalog, ulyanin. And more. And this time, to treat everything from autism. Autism is a big issue na rin.
Oh, yes, yes.
Autistic child. To Alzheimer's, other than GLUTA. That's how important GLUTA is. That's the reason why glutathione binds with harmful chemicals, heavy metals, and other toxins, and carries them into the bile. Ano yung bile? Yan yung greenish substance na pinuproduce ng liver and gallbladder. Nagkakaroon ng fatty liver, eh yung liver nga nag-gusto ng fat. What's the answer? The overwhelming amount of fats that gets inside our bodies, hindi nakakayanin ng bile na sinisig na pinuproduce ng ating liver and gallbladder. Yung gallbladder, maliit lang na part sa likod ng liver. Remember, the largest internal organ of the body is the liver. But the largest organ of the body is the skin. Okay? Kasi yung skin natin from head to foot. Pero pa siyang internal organ, sa loob, it's the liver. Kaya yung ginawang gano'n. And the liver is one of the organs na merong regenerative, nagre-regrow. No? Remember, noon sino tiga-tabig dito? Sinong congressman noon? Si ano, di ba? Si Cayetano, si Lino. Di ba? Lino Cayetano. Lino Cayetano is the son of the former Senator Rene Cayetano. Si Rene Cayetano nagkaroon ng liver cancer. Nag-donate si Lino ng liver niya. Ang donation naman sa liver, pinuputo na. Sabihin mo nga, 1/2 or 3/4. Meron lang iniiwan. But just to tell you how good a regenerative organ is yung liver, in a year's time, bumalik na ulit sa normal yung liver.
Yes.
Unlike the brain, hindi regenerative. Kaya tayo nagka-Alzheimer's kaya tayo nagka-Lianin. Although it is billions of cells, kaya lang hindi siya nag-regrow. Nababawasan siya activity. Unlike the liver, nag-regrow. But just the same, kahit mag-regrow yung liver, kung sobrang dami ng taba, wala. Fatty liver. Okay? Okay. Ay. Yan, health benefits. So, support, lapit na tayo. So, mga sabihin nyo, supports healthy inflammatory process. Can block inflammatory cytokines. If you remember, kung nag-masyado kayong conscious during the pandemic, may tinatawag tayong cytokine storm. Napawala yung mga substances na yun, inflammatory. Kaya namamatay yung pasyente. Wala, hindi na niya kung gagawin. To the point na namamatay yung pasyente. So, it can block inflammatory cells from being formed, helping to support a balanced and healthy inflammatory response in the body. Bakit importante yung inflammatory response? Kasi yun ang magsasabi sa atin mo, bakit nagkakaroon ng problema ito. So, at the earliest possible time, early stage of inflammation, gawin na natin yung paraan. Okay? Supports healthy detoxification. Again, detox. Okay? Pathway shape to reduce oxidative stress and damage from free radicals. Para din yung pagdumi. Normally, moving your bowels once a day is not enough.
Yes.
So, it makes sense to say na pagka may constipation ko yung napakasama. Ako nga lagi ko sinasabi, magtain na ako, huwag na ako titibihin. Kasi pag nagtai ka, nag-detox. Nalabas yung toxin. Huwag ka lang mag-dehydrate. And you're a fool, stupid, sorry for the word. Pagka iba'y mag-dehydrate, inom ka lang mga nabig. Gatorade, ano pa yung mga, may mga, and water. Ano ka nag-dehydrate? Sa bata, yun ang nakakatakot. But in adults, mas kasi pagka ikay lagi nagko-constipate, there's a possibility ng tao na colon, polyps in the colon, right? Hemorrhoids because of the and the possibility of you getting into colon cancer. Kaya hindi takot-takot na patay ko, namatay ng cancer sa colon. So pagka minsan na ako dumumi sa isang araw o tuwing ko na mama, pag wala ko sa buhay, minsan na mabili ng ayos. Masama yung loob ko. Minsan ko. Dapat 2-3 beses. Kahit pa nga kayo 10 beses dumumi sa isang araw. For as long as hindi siya tubig o buo pa rin siya, solid, hindi yan diarrhea. You only label it as diarrhea kung tubig na yung lumalabas. Okay? So, kung marami kang kinakain, that's really expect marami kayong dumumi. Kasi hindi maganda, marami kang kinakain, that's konti lang yung pinagtulog mo. Mas okay pa nga, kung konti lang yung kinakain mo, pero marami kang pinagtulog. Kasi kaya yung marami yung dumumi.
Na-stuck.
So, yan. Okay, supports cognitive. We'll say cognitive brain function and mental health. Sufficient levels of glutathione support a healthy mood and positive response to stress. Kaya di ba lagi natin siya, kahit si Manny, si Power Manny, si Power Mike. Minsan, na-mention nila during their mind setting. Importante yun. Always go for a positive mindset. Never go try to get into negative. Nadadala yung katawan natin because it's in the brain. Remember that the brain dictates each and every function of the different organs of the body. Siya rin nag-dictate. Pag malapot yung dugo natin, sasabihin niya sa puso, wait, you pump harder and faster para mapaikot yung dugo natin. Kasi malapot eh. So what happens na? Sa sobrang bilis, sobrang lakas ng pumping ng puso, lumalaki. That's the reason why one gets into hydrocephalus enlargement of the heart. Okay?
Ganun ba?
Damay-damay yun. Promotes gut health. Say gut, gastrointestinal, stomach. Most crucial barriers in the body protecting receiving unwanted and dangerous particles from the bloodstream. Remember, kaya natin sinasabi that the small intestines, doon ina-absorb yung nutrients na natin. Because the moment it gets into the small intestines, ikakalat nila sa dugo. That's the reason why each one of you has 20 feet of small intestines. Paano na kasi? Kung ano height nyo? 5 foot kayo. 5 foot lang. Paano na kasi yung 20 feet na small intestines? Kaya yung naka-full. Bakit siya mahaba? Because it gets directly to the bloodstream. Lahat ng dapat makinabang sa alawang pumapasok sa katawan natin should get into the blood. Because through the blood, we spend out oxygen, nutrients. Wala namang parte ng katawan na hindi mangangailangan itong abayo. Kasi reason why, ang colon natin, large intestines, is approximately 5 feet long. Nakakatawa nga, in the process of digestion, yung sapal, yung residue, yung undigested food, is the one that gets into your colon. Mind you, imagine nyo, pag sa colon nyo, dito sa right side na, itotos pataas yung dumi. Bago yung dumi, i-cross doon sa kabilang side, bago bababa, lalabas natin anus. Ganun yung ruta.
Nag-iikot pala.
Itotos mo na pataas, pupunta sa kabilang side, bago bababa, lalabas yung dumi. That's the reason why the colon is about 5 feet long.
Yung pala may small and large intestine.
When the gut lining becomes compromised, leaky gut, yung tinatawag na leaky gut, nagkakaroon tayo ng problema with our digestive tract. No? And glutathione is an antioxidant for gut. Tumutulong siya para to support the digestive function of the body. It supports the body's natural healing and renewal of the gut lining cells. Okay, supports healthy immune response. Again, importante yan. Because ang pinag-usapan natin naman ay protection, defense mechanism. Viral infections need to increase use of glutathione because of the temporary increase in inflammation and physical stress that they cause. So, upcoming infection, not only viral, kaya lang na-emphasize yung viral because of the COVID-19. COVID-19 is virus infection. Supports liver and kidney function. Okay? Glutathione supports kidney liver health by supporting the body's natural detoxification pathways. Okay? The liver, glutathione works to support the liver by neutralizing the oxidative toxin. It can damage the organ. It can even make its own glutathione to support itself. Ang liver natin, napakalaga because it can make or it can increase the level of our glutathione.